Well, good morning, everyone, and thank you to Dr. Nanji and Canadian Surgery Solutions for hosting us today. I'm here to share some good news for Calgarians and area residents who are on surgery wait lists. Help is on the way, and in fact, it's right here. I'm pleased to announce that Canadian Surgery Solutions will provide 3,000 orthopedic surgeries per year under a contract to AHS at 2 locations here in the city of Calgary. Those surgeries are in addition to surgeries done in hospitals. This contract will increase total orthopedic surgeries in Calgary by 21%. At the same time, we're adding operating rooms in hospitals with $133 million in budget 2022. Here in Calgary, we're adding 11 new operating rooms at Foothill Hospital to be open in 2025. And we're expanding and building new ORs in Edmonton, Edson, Grand Prairie, Lethbridge, Medicine Hat, and Rocky Mountain House. We need to get wait times down, and that means we need to fund more surgeries. And what we need to do is use all the tools at our disposal to make this happen. We need to add ORs in hospitals and contracts chartered surgical facilities to add this capacity. We need to look for unused capacity, especially in smaller communities, and use it if we possibly can. We're moving forward through the Alberta Surgical Initiative. The first priority we addressed was cataract surgery, and we've seen real improvements to date. We contracted more surgeries, and we cut the wait time almost in half to 10 weeks last year from 19 weeks in 2020-2021. That's the shortest wait time since 2014-2015. We still need to get it down lower, so we'll keep contracting more surgeries, but we've shown the way forward. Patients waiting for cataract surgery were the single largest group on our overall wait list. The biggest group now is orthopedics. The wait times are far too long, and we have to get them down. We've tasked Dr. Cowell, the AHS official administrator, to accelerate the work underway to do more surgeries in hospitals and in chartered surgical facilities just like this one. It's not one or the other. Contracted facilities and hospitals are managed in common through our publicly funded healthcare system. Contracted services are publicly funded services, just like in hospitals. Patients are assessed and waitlisted in common, and they get care from the same surgeons according to the same clinical standards. When we fund more services, either in hospitals or in CSFs, the publicly funded system grows. Hospitals and CSFs don't steal staff or physicians from each other. They're part of the same system, and they grow together. Now, this contract means thousands more patients will get their joint replacement sooner. Right now, there are about 6,000 people waiting for orthopedic surgeries in Calgary alone, and they're waiting too long. About half the patients waiting for a new hip are waiting too long, and 2/3 of patients waiting for a knee. We're making progress in surgery, but quite frankly, we have to do more. AHS has restored surgery volume to about the same level as in 2018-19 in recent months. And the total surgery wait list has trended down slowly over the past year, from more than 81,000 in the fall of 2021 to in between 68 to 70,000 most recently. Dropped in around 68,000, and now it's sitting, this is prior to Christmas, and now it's sitting about 70,000. Now, it's fluctuated with the holiday season in December, about the same as in early 2020 before COVID, which was the 68,000. Now, that's real progress, and our surgeons and staff deserve credit for it, but we have to do more. And that means, first and foremost, we have to fund more surgeries. We campaigned in 2019 on a commitment that every Albertan who needs scheduled surgery would get it within a clinically appropriate time. It's an ambitious commitment, but we stand by it, and we're working to deliver on it. The pandemic has stretched out the timeline, but we're still working towards reaching the goal next year, just 1 year later than our original plan. It's been a tough 3 years, and this winter is straining our health system all over again. COVID is still impacting the system, and we've been challenged by an early and severe wave of flu and RSV on top of that, with all the other health impacts that those viruses bring. But for now, at least, we're seeing all 3 of those viruses trending down, and that's bringing some relief to the hospitals. I was very glad to hear recently that the pressure on Alberta's Children's Hospital has eased, so that the AHS was able to reopen services at the Flames Rotary House. I hope the worst of the winter is behind us, but the system is still under real strain. We need to keep adding resources to the system regardless, and we're doing that. We announced recently that more ambulances and paramedics are coming to Calgary, and we're continuing to add continuing care beds, home care, and other services funded in Budget 2022. And we're looking at where more resources are needed, on top of the $600 million increase that's already budgeted for the 23-24 fiscal year that starts April 1st. Adding capacity to the health system means adding skilled people, and we'll be announcing more measures soon to support expanding our healthcare workforce. We'll also keep working with the AMA to move forward based on our new agreement, and we'll continue to engage with family doctors and others to renew primary care. I was pleased to see that we had a net gain of more than 250 physicians in the province in 2022. We have a lot more work to do, but I think we're turning a corner. Alberta is historically the best place in Canada to practice medicine, and we're working hard with the AMA and others to keep it that way. It's been a tough 3 years for everyone working in our health system and for Albertans, but we are moving forward. We promised Albertans a stronger publicly funded health system with better access to care. We stand by that promise, and we're working on it every day to deliver on it. And this announcement today is a key step forward, and we'll keep working with our physicians and staff and with partners like Canadian Surgery Solutions to make sure Albertans get the care they need when they need it. So thank you again for coming out this morning, and now I'll turn it over to Dr. Cowell to say a few words on behalf of AHS. Dr. Cowell.
Thank you. Thanks very much, Premier, and it is a real pleasure to be here, and I appreciate the opportunity to say a few words. I'd like to start off by saying and congratulating the teams at Alberta Health Services, Canadian Surgical Solutions, and Alberta Health for reaching this important milestone in Alberta today. This new contract and arrangement will play an important role for Albertans accessing publicly funded services like surgical services for long-awaited surgeries like hips, knees, and shoulders. They're going to be able to enter the system much more efficiently and effectively now through the publicly funded system with this new facility that's coming online. And it's our belief and hope that we will very quickly have a seamless relationship between the surgeries that are performing within Alberta Health Services' own facilities and this type of facility out in the community. We've carefully understood, which ones would occur here versus which ones should stay within the hospital system. And we've come to a very solid understanding through the accrediting process, the privileging process, to ensure that surgeries which are performed in CSF, the chartered surgical facilities, will meet all of the necessary standards that would have been and are applied in Alberta Health Services' own surgical facilities. And yeah, I'm pleased to be here for another reason. As you know, I've met many of you before in some of these releases. I've been appointed as the official administrator with 4 key priorities. Already announced a few and spoken about improvements in our EMS response times. And we're working very hard on our emergency department wait times. And now the one that we're here to discuss today, reducing wait times for surgeries. So with increased capacity such as this, and more to come, we're going to be able to make a measurable impact on those waiting for surgeries, measurable impact on those waiting outside of our clinical guidelines, bringing them back in and getting them done and home. And we're going to be able to monitor very carefully, the impact on health and care and safety in that whole process. I personally find this very exciting because we found a way to increase capacity without having to necessarily build more hospital space, but we're working on that in terms of improving available hospital space. It's very exciting, actually, as a citizen looking in, watching the flow improve now. And we have high expectations. The key is a seamless relationship between Alberta Health Services booking and deployment of our surgeons and our anesthetists so that there's a perfect balance between this new resource and what occurs within Alberta Health Services' own surgical facilities. You know, I can't just say enough about enhancing capacity for publicly funded surgeries. It's just going to be actually quite amazing. And never forget that this is all about enhancing quality and better patient outcomes. That's what it's all about. So again, I'd like to congratulate all of those who struggled so hard to get this concept up and moving. And now our challenge is make sure it works well now that it is here and in place. So now at this point, I'd like to invite Dr. Mohamed Nanji, who's the medical director of the Rocky View Surgical Site, as part of the Canadian Surgical Solutions, to say a few words about how that's going to work. Dr. Nanji.
Thank you, Dr. Cowell.
Squeeze by you here.
Oh, sure. Minister Copping, Dr. Sid Weiner, Dr. Werle, members of the CSS staff, members of the press, good morning, still morning. Thank you for joining us today for this important announcement. As a result of this announcement, our surgical facilities will significantly increase Alberta Healthcare's orthopedic surgery capacity in a sustainable way, as Minister Copping highlighted. Surgery will be performed in our state-of-the-art facilities, equipped with the latest technology. They will adhere to the strict regulations as the hospitals and are inspected and fully accredited by the College of Physicians and Surgeons of Alberta. What does this announcement mean? For Albertans, surgery will be performed by the same surgeons, care will be of the same high standards offered at the hospitals, and importantly, the wait times for surgery will be shortened. The continuance of care provided from pre-surgery through to post-surgery is just like in the hospital system. What do we bring? We have been integrated with the public system for more than 30 years as a trusted provider of publicly funded surgeries. We have worked in partnership with the Alberta government, Alberta Health Services, and its predecessors, the Calgary Regional Health Authority and the Calgary Health Region. Important is our dedication to putting patients first and at ease, and making the process as smooth as possible so they can focus on recovery and getting back to their normal life. Like all Canadians, we hold our healthcare system near and dear, and to the envy of many, in the highest regard. We hope our continued participation in the Alberta's surgical care will contribute to the long-term health benefits to Albertans. Thank you to Minister Copping, Ministry of Health, Alberta Health Services, and the people of Alberta for the opportunity to provide more timely access and high-quality care to Albertans. We look forward to serving Albertans. Thank you. I'll invite Dr. Werle to say a few words.
Thank you, Minister Copping, Dr. Cowell, Dr. Weiner, Dr. Nanji, for this opportunity to speak today. I'm an orthopedic surgeon and the section chief of orthopedic surgery for the Calgary Zone within Alberta Health Services. As part of my surgical activity within Alberta Health Services, I perform publicly funded orthopedic procedures, including hip and knee replacements at the Rocky View General Hospital, as well as at this chartered surgical facility. Patients and their families are at the center of everything we do at AHS. Patient safety, experience, and outcomes are always our top priority. So regardless of whether an Albertan receives their surgery within a chartered surgical facility or at an AHS hospital, the standard of care is measured the same way. The CSFs are regulated by the College of Physicians and Surgeons of Alberta. So when I'm providing publicly funded surgical care at this facility on behalf of AHS, the care team and I are following all of the same policies and procedures. As a result, the care is safe and efficient. Many patients who have received surgery within a chartered surgical facility such as this have had a positive experience with the care provided. I think that is due to the attention to the patient experience. We know that a focused team in a dedicated facility can lead to excellent results for patients. The pandemic negatively impacted the surgical wait lists, and it has taken considerable effort to get back on track. I'm proud and honored to work with our AHS and CSF surgical teams and collectively will continue to work hard to reduce wait times. I'm grateful for the opportunity to provide surgical care for patients at Canadian Surgery Solutions. It helps to free up capacity in our AHS facilities and helps Albertans get the care they need faster. Thank you.
That concludes the formal portion of our announcement today. We'll start the question and answer portion. Take questions first from the room. Please, if you have off-topic questions, please save them to last. I will take one question, one follow-up. Just state your name and outlet.
Michael King, Global News. For Dr. Cowell, if I could please. There's a lot of talk of ensuring that the level of care, whether or not it being in a hospital or a chartered facility, is the same. What steps are there from the province's perspective to ensure that that is the case? And also, is there any consumer protections in place to ensure that there's no sort of upselling in chartered facilities?
Oh, yeah, those are excellent questions. So there's a series of safeguards in place that I could speak to. One, there's going to be a very strict contract in place for the deliverables and the cost structure that will be and has been negotiated between the Calgary Surgical Solutions and the government and Alberta Health Services. Alberta Health Services now will be having responsibility for oversight on that contract. So the whole setup was done along with Alberta Health, but now it transfers absolutely into our jurisdiction to be sure that, as Dr. Werle was referring to, and Dr. Nanji, that the highest standards will be met. That's why I wanted to use the word seamless today, because this whole relationship is going to be seamless, right from the point of booking the surgery, right through to the assignment of the surgeons and the anesthetists who will be performing the surgery. And each of these sites, and this one in particular we're talking about, have already gone through the process of privileging physicians to actually work here, absolutely consistently with the way we privilege surgeons to work. So we know that they are qualified and have the highest standards. So, and then the third part of this is the College of Physicians and Surgeons have this accreditation oversight that literally means every aspect of this facility and its operations must meet the standards of the College of Physicians and Surgeons. And we left it there because it really is all about physician behavior as well as facility behavior. So I can tell you unhesitatingly, myself or any of my family or anybody in this room would come here and know that you were getting exactly the same high level of care as you would at Alberta Health Services. And I also mentioned in my speech that we've been very careful about which surgeries come here versus which ones stay. Anything that's really major and complicated stays within Alberta Health Services. Those which meet the test of being able to be handled in an off-site location, generally with the most of a 24-hour to maybe a couple of days stay post-op, then they absolutely can be done here safely. So I think that's kind of my summary of a complicated kind of relationship that ensures highest quality and safety and economically makes complete sense to the publicly funded system. Because remember, we're talking about cases that no patient pays any money to come to do. It's just as if they were in the hospital. We're relieving the stress on wait times and people who are waiting outside of the clinical guideline, flowing them in here where there's a readily available facility that can handle those level of complexity and severity cases. Okay?
And for Mr. Copping. Pressing health issue going on right now, 811 outage as well as other systems within the province here. What sort of impact is that having at hospitals currently right now? And what are we looking at in terms of wait time to get this system up and running?
So I'll start, and then I'll actually ask Dr. Cowell to further the response. Yes, we are aware that there's a challenge within the system. I understand 911 is continuing to operate. 811 is actually operating right now, but not in its full capacity. It's an initial assessment that's an internal issue in terms of the system within AHS, which is a positive thing. So they're working hard to fix it right now. But Dr. Cowell, can you speak further on the issue and then how we're addressing?
Yes, I was made aware of this virtually not long after it happened. So we've been tracking it for a couple of hours now. So up to very recently, as the minister said, 911 is okay. 811 Health Link now is properly backed up and working very hard to get that working. The clinical support, Connect Care and Net Care, is down. And of course, everybody knows that that's not a good thing. And it's all hands on deck to get that sorted out quickly. And I don't have an update at this moment as to exactly when that will actually be achieved, but there's no higher priority than to get that clinical support technology up and running as fast as possible. So at this moment, no, it is not operating, but I'm being reassured that it's an internal problem. They now figured out that it's something we can get our hands on. And so that's, of all the possibilities, that's probably the best. So we're working very hard from a technology input, but specific to clinical impact, which of course is the #1 priority. Now, I'm going to ask Sid if he's got some additional information. He's our VP Corporate Clinical Services. So Sid, if you could say something.
Thanks, Dr. Cowell. So as noted, it goes without saying that, it's all hands on deck to get the clinical systems back up and running. 811, as mentioned, does have some backup capacity that's being utilized. We have downtime, what we call downtime procedures for, when these sort of events occur, and those are in place. They rely on more use of paper since the computerized systems are down, and more use of the paging system, which when it goes through the phone line still works, and direct communication using phones between physicians and staff and physicians to other physicians. So that's all in place. Operations continue, and people are working to get everything back up and running ASAP.
Go ahead with the next question.
Sid, was just wondering if you could say and spell your first name for us so that we have it on record. Or first and last name, sorry.
Yeah. Dr. Sid Viner, S-I-D. Last name Viner, V as in Victor, I-N as in Norman, E-R. And I'm the Vice President and Medical Director for Clinical Operations, Alberta Health Services. Thanks.
Thanks very much. I'll have one on the Connect Care, and then I'll have a surgery question. On the Connect Care, 911 isn't down, but we have heard that there are some dispatch problems, calls being routed incorrectly kind of between EMS and fire and police. Do we have any information on this?
Yeah, I think what happens when the computerized systems go down, which is what we're experiencing right now, is a much heavier reliance on basically the telephone and other forms of communication which are less efficient and a bit more time consuming. So when this sort of thing occurs, we have to really focus on prioritization, just make sure that we're getting to what's most emergent or urgent first, and that's what we're really focused on right now, working on right now. But definitely things are clunkier, if you will, and less efficient than they would be otherwise.
On surgeries, wondering if there's any specifics on what the wait time currently is for those orthopedic surgeries in the Calgary Zone, as well as what the total surgical wait list is for Alberta. I know that the goal was to take that below 68,000 by the end of 2022. Did we hit that?
So I'll start off in terms of the broader question, then I'll ask Dr. Werle to comment on the specifics in regards to the wait list here in Calgary. So we are working very hard to get the number down to 68,000 and below. That remains our target, and initiatives and facilities such as this will actually, quite frankly, help us get there. Especially, they're doing the work right now, and orthopedic surgeries is the category with the highest number on the wait list. We were very successful in regards to ophthalmology and cataract surgeries using CSF to drive that down. So very optimistic this will actually get our targets. But I just want to hear 68,000 is still way too high, right? It's getting so that's why we're not going to get there by get everything within its recommended wait times by this spring, but we are still targeting to drive that within another 12 to 18 months from now to actually get those numbers down, and we're going to keep driving. Dr. Werle, do you have the numbers in regards to the total amounts for the Calgary on the wait list for orthopedics?
Thank you. Yes. So the wait list for all surgery in the province, as the minister has indicated, is about 68 to 70,000. For orthopedics within the Calgary Zone, there's about 6,000 patients on the waiting list. More than half of those would be waiting for a hip or a knee arthroplasty. Our average volume prior to the pandemic was in the 3,000 to 3,200 arthroplasty cases in the Calgary Zone per year. And so generally, if you extrapolate that, it's more than a year's wait for the hip and knee replacement. And the national benchmark is to have that surgery within 26 weeks or 6 months. Thanks.
Hi, I'm Nicole with CTV Calgary. My question is for Minister Jason Copping and anyone else who might want to weigh in. So, yeah, of course, today's announcement is about orthopedic surgeries, but we know many other surgeries are impacted by long wait times right now. One that I'm hearing about is actually tonsillectomy surgery. I know one person I spoke to was saying they were told they'd have to wait a year to 2 years to get it, and they're from Calgary. Not sure if that's a common thing you're hearing, but I guess my question is, how are you guys addressing wait times for things like that? I mean, especially considering it is a pretty common surgery.
Yeah. So I'll provide a general answer, and then maybe Dr. Cowell, if you want to add to that. The one thing about leveraging charged surgical facilities like this one is it allows us to take surgeries out of the hospital, so more surgery can be done in the hospitals, right? Provide capacity for surgeries like tonsillectomies and other surgeries. In addition, when we take a look at our top three categories, it is orthopedics, ophthalmology we talked about, and then what we call general surgeries, often gastrointestinal, those types of things. So we that is next on the list. Like this, we're not stopping at orthopedics. In fact, we have RFPs out in the central and south zones that combine all three, because you need a certain level of volumes to be able to do this, which again would provide more capacity within our hospitals to do that. Plus, we are investing in our hospitals as well, particularly in rural areas, and as we said, mentioned earlier in remarks here in Calgary, expanding the OR. So this is, sadly there is no silver bullet. You look at other provinces across the country. Many of them are actually worse shape than we are in terms of getting caught up. We've started down this process in terms of expanding our capacity 3 years ago. It takes time to build that capacity, but it's coming online, which is very positive, and we are going to get there. Dr. Cowell, do you want to speak further?
Thanks, Minister. That's a great question, because, of course, this is all about increasing capacity in the face of wait times that are just simply too long. And actually, there's well over 80 chartered surgical facilities, all covering various areas, including ear, nose, and throat, which is tonsillectomy. But the happy news is we have Dr. Viner here, who actually has very specific information, and I think he'll answer the question quite precisely for you.
Yeah, really important question, and the goal through the Alberta Surgical Initiative is to bring down wait times for everybody who's waiting for every type of surgery into what we're calling a clinically appropriate timeline, or the target timeline. Varies depending on the type of surgery. So for many cancer surgeries, they have to be done more quickly than surgeries where the time frame may impact people's quality of life, but not their length of life. So all the different types of surgery have different types of targeted wait times. It's a comprehensive approach we're taking, so it begins with ensuring that the wait lists are accurate, updated regularly. Sometimes patients are booked with more than one surgeon. Sometimes patients no longer need surgery. We're putting a system in place where subspecialty by subspecialty we'll have central intake, which means all the referrals will come to one point. And that allows us, A, to have very accurate data, and B, to give patients and their referring physicians the opportunity to choose surgeons with the shortest wait times. And, we're tracking those wait times quite closely for the different surgeons. So kind of load leveling across surgeons and facilities, if you will. We're really looking at expanding capacity. So today's announcement is very much about expanding our overall surgical capacity. And as was mentioned, that expansion isn't limited to cataracts or orthopedic procedures. It includes all types of different surgeries that can be done safely and efficiently without needing an acute care hospital stay. And then we're looking at really driving efficiency and how we utilize all our ORs so we can make sure we're doing as much surgery as we can given the resources available, including staffing, which is a bit of a constraint right now. And then finally, really looking at utilizing our rural operating rooms to maximum capacity. And again, it's all about looking at resources available and how we best apply those to bring wait times down for everybody.
Thank you.
You bet.
And as a follow-up, this is, again, for the health minister or anyone else who wants to weigh in. So my question is if you have a response to critiques that today's announcement is another move towards privatizing healthcare in the province.
Yeah, I just want to be really, really clear with Albertans and everyone. This is public health care, right? This is no different than you going to see your family doctor, and that's paid through our healthcare system, and it is a private corporation. This is, contracting additional resources to build our system, and we've, as I mentioned in regards to ophthalmology, we've already had success. Right, getting the wait times down, building more capacity, and because that's all that they do, they get very, very efficient at it. So because of that efficiency, we look at the ophthalmology contracts, for example, roughly 20% savings for surgery, so we can actually reinvest to do more surgeries associated with that. And because they're very efficient, and as Dr. Viner indicated, we have challenges in our province, just like every other province across the country, with health human resources. So even though we are continuing to work to expand the amount of people in the system and during hiring, and it's great that we have CPSA an additional 250 more doctors coming into to Alberta Q4 last year versus Q4 the year after that. We're expanding it. We still have challenges. So to use those more efficiently, and when that's all you do, like cataract surgery one after another, we can use the limited resources to do more surgeries more efficiently. So quite frankly, this is public health care. We are investing it. We know that we need to increase our capacity because people are waiting too long. Far too long. And we knew that even prior, 4 years ago. We're making progress, but we need to move faster. And again, publicly funded, publicly administered. AHS is continuing to move the docs around in terms of be able to assign the patients. This is public health care.
Thank you.
Can I ask a question? Just more on that. I just wanted to clarify. So when you are doing surgeries in this facility, are you saying then they're less expensive per person? Like, is it cheaper, or what's the cost difference between coming here for a publicly funded surgery versus in the hospital?
Yeah, so we're still finalizing the exact number. We know from the ophthalmology, because that's been in play for a while, that it's roughly 20% cheaper to go to a chartered surgical facility per procedure, right? And then that allows us to be able to reinvest for the next procedure because we have a long wait list and we have to do it. But it's actually not surprising because when you focus on just one thing, like, and don't get me wrong, this is not a knock on our public system. Like, our public ORs have to be, quite frankly, ready for anything. Right? You booked an OR maybe for scheduled surgeries, but then all of a sudden you have an emergency come in. They actually have to clear that deck because that gets priority, and all the tools and I'll get Dr. Cowell to comment on this because from a medical standpoint, but everything you have to have prep for that OR needs to be ready to do everything. Where when you're doing scheduled surgeries in a facility like this, you only need a certain amount, so you can be way more efficient. So it makes sense, and it's still the high quality. As Dr. Cowell mentioned, in terms of not only the college ensuring and inspecting all of the charged surgical facilities is the same quality. It is the doctors that are assigned by AHS, the anesthesiologists, they're the same doctors going through. So it's the same service. It's just focused to be able to provide more efficient service at a lower cost so we can do more and expand capacity. And Dr. Cowell, do you want to elaborate further?
Yeah, no, that's good. The other thing I wanted to ask, and maybe it's for the facility folks. So just so I'm clear, so when you're not doing publicly funded surgeries, or do you just do publicly funded surgeries? Like, do you also do, I guess, private or whatever you want to call it? Where people would pay out of pocket, or insurance companies or whatever? Just so people understand.
Okay, so, thank you.
Yeah.
We are concentrating on Alberta healthcare patients and Albertans at this stage. The patients who require non-insured services like cosmetic surgery or de-insured dental or something can be done in these facilities. So right now we are concentrating purely on orthopedics and Alberta healthcare patients.
Okay, thanks.
All right, we'll head to the phones. Operator, could put through our first caller.
Alex McQuaid, Western producer.
Hello. This question is for the minister, unless someone else wants to chime in. You talked about adding surgical capacity at rural hospitals. I guess with currently over 30 rural hospitals seeing temporary bed closures right now, I mean, will this initiative take anything away or improve that situation?
Yeah, I'll start with the answer and I'll ask Dr. Cowell. So the initiative, and just so we're clear, we're already doing some of this already. So I want to use Red Deer as an example in Olds. We are having surgeons and a surgical team working with the doctors in Olds to deliver surgery in that area, so that people need to travel less, and we actually leverage the ORs that we have there in it while the ORs in Red Deer are working. But so we're doing it already, and what we're looking to expand that. You're quite right that one of the challenges is, particularly in rural Alberta, is health human resources, and we're doing significant work in that. I was pleased as part of his budget 2022. Minister Nicolaides made an announcement, quite frankly, to add thousands of seats for healthcare professions, including nurses, LPNs, healthcare aides, paramedics, and others, allied health professionals, to be able to get them trained up and working. Also, we're continuing to do work in terms of streamlining our processes and bringing more internationally trained nurses into Alberta, in particular into rural Alberta. So that work is ongoing, so we can staff up not only our surgical suites and our surgical teams across the province, but also ensure that where there are closures, we can get those beds opened and offer services full time. And I can tell you that more is coming. We're continuing to work on this as part of the budget, and stay tuned. We'll have some more announcements shortly. I know, Dr. Cowell, do you want to add anything to that? Okay.
Yeah, excuse me, I get no water, but I'll suffer through this. It's an older person's condition. You get this phlegm. Excuse me. Now, I'll stop that. That's a great question, and I really want to give the answer. And the answer is we're looking at balance. This has got to be a seamless, incremental approach to OR capacity. So that doesn't mean we're going to diminish capacity anywhere else, we're adding capacity. It's always that idea. So that means we're looking very hard at our rural facilities, going through a very detailed audit. And, you know, some of those rural facilities have very old equipment, old setups that you just simply couldn't get moving again. And when you run into a situation like that, it's just not economically or from a staffing perspective realistic to try and bring them into the 2022, 23 era. The investment and the time, which just simply wouldn't achieve the goal. But there are places that we've discovered we can move fast rurally. And one of those is in Camrose, where, oh, thank you so much. Yeah. Appreciate that. So, now if I don't choke in the water, I'm going to do really good. Camrose was an interesting situation. There was 3 operating theaters and only 2 were moving. And when we looked at it hard, we realized it was really a ventilation problem. So why not fix that? And which we have. Then the other thing is, where are the surgeons? Where are the anesthetists? Like, are they nearby? Well, yes, they were. So they were thankful that we were able to get that one going up and running, and that's in real time. That's weeks to months. So we're trying to discover places like that throughout Alberta, and Camrose is just a darn good example of when you can really maximize a rural area and not miss it, you know? Meanwhile, concurrently, we're doing things like this, getting CSFs up and running, and with all the safeguards we've been discussing. And it's all, always remember, through the lens of publicly funded. Now, what else this place would do after their commitment to us is, it's up to them. But it doesn't get in the way of our contracted relationship. So that's kind of one of the basic principles. So that's, unless I haven't answered your question, that's the way I would tell you the answer.
Alex, do you have a follow-up?
Thank you for the water.
Yeah, just as a follow-up, I mean, I guess, is it a situation of kind of robbing Peter to pay Paul when you, like in Rocky Mountain House is one of the areas that you say you're going to expand surgical operations. But at the same time, Rocky Mountain House has been for, I guess, over a year and a half, has had some of its acute care beds unavailable. I mean, what are they 2 separate issues, or can you address both of them at the same time?
You know, that's a very specific question, and I'm going to see if Sid has a more specific answer than I could give you. Dr. Viner?
I'll give you a very succinct answer. Day surgery. So we do more and more surgery without requiring an inpatient stay, without needing an inpatient bed. It's kind of the way a lot of surgery has gone. So, you know, even within our regional and urban sites, you know, big shift towards doing more and more surgery, you know, basically on an outpatient basis. And that's where the opportunity will lie in a facility like Rocky Mountain House or any others where, you know, the acute care beds may otherwise be limiting. Does that answer it?
I think so. It sounds like it's 2 separate issues, basically, and they're not directly related. Is that correct?
I would say for the rural facilities, you know, it's certainly manageable, and you know, a lot of our, you know, a lot of the surgery that we would want to do in those rural facilities will be done on a day surgery, basically outpatient basis. People would come in the morning, have their surgery, and leave without ever needing to receive care in an inpatient bed. Yeah.
All right, operator, can you put through the next caller?
Catherine Grigowski, Alberta Today.
Hi, thanks for taking my question. I'm hoping someone from Alberta Health Services can get back to me online for a more recent report. But looking at the annual report for non-hospital surgical facilities for cataract, non-cataract surgery from 2019-2020 fiscal year, it shows that $500,000 in Calgary and $1.6 million in Edmonton was revenue generated from the sale of enhanced medical goods or services. And I'm wondering if this is publicly funded surgeries, why are these enhanced medical services allowed to be charged for in these facilities?
Yeah, Dr. Viner and AHS will have to follow up with you on that.
Catherine, do you have a follow-up?
Yeah, and so when we're talking about the 20% difference between ophthalmology, for instance, delivered in a private clinic versus in an AHS facility, why do you think that's a fair comparison if the surgeries that are done in the chartered facility are far less complex, require far less of a hospital stay?
Yeah, so my understanding is that is a comparison, the same type of the same type of surgery, the same type of procedure, AHS versus the chartered surgical facility, which would be a fair comparison. But as I said, when it makes sense to me because that's all that facility is going to do, whereas our hospitals need to do a far broader range and be ready for a far broader range of potential procedures.
All right, thank you. Operator, can you put through the next caller?
Alana Smith, Globe and Mail.
Oh, hi there. Thanks for taking my question. Just following up on some of my colleagues' questions about, I guess, this fear that we're moving towards privatization of healthcare. I'm just wondering if at any point, and this is a question for Minister Copping, if at any point you're worried about, I guess, an over-reliance on using these sort of private facilities to, lessen these surgical wait times, and if there's any way that this could actually be addressed in the public system, or if that's a goal for the future.
Yeah, so we're focused right now. We know we need to add capacity both in our hospitals and leveraging chartered surgical facilities. And that's what we're doing. Our wait list is far too long at this point in time. We need the additional capacity to get it back down. Chartered surgical facilities have been a part of our system for decades. We're increasing the number of surgeries that they are doing, and we've gone from like 13% to 20% of overall surgeries. But we need to be able to do it, and again, by ensuring that we have high quality, efficient service, reduces our costs. For certain types of surgeries, like again, the day surgeries or very specific surgeries, so that leaves our hospitals be able to focus on the more complex surgeries, and it's going to require, as Dr. Cowell indicated, a balance. But again, we need the additional capacity where we can get it to get caught up, and that's what we're focused on.
Thank you very much. Operator, can you put through our last caller, please?
Oh, sorry. Can I get a follow-up?
Quick follow-up, yeah.
Yep, sorry. It's just an unrelated question. I'm just wondering, Mr. Copping, if you could give us some sort of update on the federal health deal, just kind of what type of arrangement Alberta wants and how those negotiations are going so far.
Yeah, so I'm not at the table specifically on this one, but we have asked the federal government for additional funding, as you know, to increase back up to 35%, with no strings attached, and we have a number of measures already that are publicly available, and we continue. So I understand that the discussions are ongoing.
Okay, operator, can you put through the last caller?
Barrett Cash, CTV.
Hi there. Just in regard to AHS system outage, we're hearing that dispatch was having to call ambulance individually with 911 calls, and paramedics are then being told to Google Map where they're going. Obviously, this creating major slowdown in response times. What's your reaction to this?
Yeah, so I haven't got a full briefing on the impact on 911. My understanding of the system is still working, but the reality is that improving response time is a key deliverable for AHS and Dr. Cowell. We are investing heavily on that. One thing that Dr. Cowell and I have also chatted about very briefly is that, once we get to the bottom of what happened here, to be able to make sure that it doesn't happen again. And I know that the team is working very hard to mitigate any impacts, whether it be 911, 811, or on providing the service, because this is the service that Alberta needs and Albertans need, and we need to support them in that. Dr. Cowell, anything further?
Just to reinforce the message that it's all hands on deck. We realize that this is an unusual, unique event. As far as I'm understanding, it's never happened quite like this before. So we need to figure this out fast and make darn sure it doesn't happen again in the future. Everybody is working very hard, flexing very hard to be sure that all of the systems all of the activities and actions that are dependent upon this system are covered in other ways. So stay tuned. I'm sure this is going to be a developing event over today, and we're actually quite anxious to leave and to get back working with it. Now, Sid, did you have anything else, or is that just for you?
Can I have my follow-up? Just as a follow-up, we're also hearing, with hospitals being quite backed up, staff are having to whiteboard everything because computers are down. Can you confirm this?
Yeah, so as was discussed earlier, the computer systems largely are down, so we are having to use paper, whiteboards, phones more than we would in our day-to-day clinical practice, and it's definitely impacting workflows. We have downtime procedures. They're well established. People know what to do in these situations. All of that is being done. It will slow down, workflow, but again, we'll prioritize so that what's emergent, urgent, what's most important will get done. Will get done. It'll get done first. It'll get done. And as far as some of the other system impacts, we will be providing regular updates to the public and to media over the course of the next hours, the day. And I was going to say I'm not a social media buff, but that is how we communicate these days apparently. So some of it will be coming out over social media. Yeah, so you guys can all watch for those. Okay.
Thank you very much. That's all the time we have today. And if you have any other questions, follow up.